Do you know if you are COVID-free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID-19 testing locations around the island. Book online at www.gov.pm/coronavirus-get-tested or call the COVID-19 hotline at 444-2498 between 9 a.m. and 9 p.m. Everyone in Bermuda can help us stay COVID safe.
Good evening, Bermuda. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide you with an update on the latest vaccination statistics, rule changes for immunized persons, and further updates from the Ministry of Health. Following the Minister of Health, I will update the country on the COVID-19 regulation changes approved by the Cabinet earlier today, which will be in effect for the next 2 weeks, matters surrounding Bermuda's tourism economy, and a preview of the House Assembly, which resumes this week, Friday. And I am overjoyed to be joined again today by the Chief Medical Officer, Dr. Ayo Oyinloye, who will assist with any technical or medical questions from the media. First, on this wonderful Tuesday evening, a warm and sunny Tuesday evening for February in Bermuda, we will begin with the Minister of Health. Minister?
Good afternoon, everyone. Today there were 242 test results received by the Ministry of Health, and none were positive for COVID-19. Additionally, since the last update, there were no recoveries, and there currently are 4 active cases, and their status is as follows. 3 are under public health monitoring, and 1 is in hospital, and none are in critical care. Since March 2020, Bermuda has recorded 695 total confirmed cases of COVID-19, and out of those, 679 persons have totally recovered. 12 persons have sadly succumbed to COVID-19. And the mean age of all of our positive cases is 43, with the median age being 40, and the age ranges from 1 year to greater than 100 years. To protect privacy and confidentiality, age information will not be provided with respect to the active hospital cases. The mean age of all of our deceased cases is 75, with the median being 77 years, and the age ranges from less than 60 years, which is the age groups of 50 to 59 years, to greater than 80, which is the age group of 80 to 100 years. And the source of all cases is as follows. 201 are imported, 493 are classified as local transmission, of which 402 are local transmission with a known contact or source, and 91 are local transmission with an unknown contact or source, and 1 is currently under investigation. As investigations proceed, transmission categories may change. Of the more than 170,000 test results reported, the mean age of all persons tested is 43 years, with the median age being 42, and the ages range from less than 1 year to greater than 100 years. Additionally, during the week of the 7th to the 13th of February, 253 saliva screening tests were conducted. Therefore, as of the 13th of February 2021, results have been received for 5,123 saliva screenings. The mean age of all persons screened is 59 years, as well as the median age also being 59, and the ages range from less than 10 years to greater than 100 years. And the 7-day average of our real-time reproduction number is less than 1, and Bermuda's country status remains at sporadic cases. On the subject of testing, again, I must remind residents needing outbound COVID-19 tests that you must book yourself in for the outbound travel testing via one of our community sites at Pennell's Wharf, Bull's Head, or Star of India. Do not go to PROT's post office at this time. You can book through gov.bm/coronavirus get tested. There will be no walk-ins. It is critical to book at least 2 days before you plan to travel. This meets the 72-hour rule imposed by the United States, the United Kingdom, as well as Canada, and gives the MDL lab more leeway to process results in time for your departure. You should not get the test the day before you intend to travel, as there leaves no room for unexpected delays. Please visit gov.bm for information on outbound testing. I would now like to provide you with an update on our vaccination program. We have completed the 5th full week of vaccinations and the 3rd week using 2 vaccination centers operating 6 days a week. For the 5-week period from the 11th of January, when we commenced vaccination, to the 13th of February 2021, Bermuda has administered a total of 12,568 vaccinations, a figure that rises to include 13,155 if you include yesterday's vaccinations as well, all of which is a great achievement. Of the 12,568 vaccinations administered for the period that we are reporting on, which includes up until the 13th of February, the statistics are as follows. 6,983, or 56% of those vaccinated, are women. 5,585, or 44% of those vaccinated, are men. Bermuda's goal of herd immunity will be achieved when 70% of our population, and our population is 64,054, has been immunized. And to date, 15% of our population has been vaccinated with at least 1 dose, with 4% of our population having fully been immunized, having received 2 doses. Each week since the 11th of January has been an increase in the number of vaccinations administered, with 3,467 vaccinations delivered last week. The public has accessed these vaccinations as follows. The vaccination center at the Police Recreation Club administered 57% of the vaccinations, or 7,135. 697, or 5%, were administered at rest homes and long-term care facilities. 4,641, or 37%, were administered at the Bermuda Hospitals Board Vaccination Center, and 95, or 1%, were administered at other vaccination sites. Assessed against Bermuda's vaccination priority targets in Phase 1, 1,834 persons, or 59% of those aged 80 years and older, have been vaccinated, and 1,300 have had 1 vaccination, and 534, or 17%, have been fully immunized. 370 persons, or 50% of residents in rest homes and long-term care facilities, have been vaccinated. 96 have had 1 vaccination, and 274, or 37%, are fully immunized. 1,226 healthcare workers, or 50%, have been vaccinated, and 346 have had 1 vaccination, and 880, or 36%, are again fully immunized. 1,192 essential workers, or 50%, have been vaccinated, with 634 having had 1 vaccination, and 558, or 24%, having fully been immunized. In Phase 1B, 4,161 persons, or 44% of those persons aged 65 to 79 years, have been vaccinated, and 3,627 have had 1 vaccination, and 568, or 6%, are fully immunized. These are great results so far, and I would like to thank all of those who have taken the step to get vaccinated to protect themselves, their family, and our community. I want to continue to encourage our extremely clinically vulnerable persons, our healthcare workers, and people over the age of 80 to please get vaccinated. We need you as the backbone of our community to be one step closer and safer to this pandemic. With that, I would like to announce that we are now moving into Phase 2 of our National Vaccination Allocation Strategy. In Phase 2, we encourage anyone over 50, an essential traveler, whether it be for medical or school purposes, persons with heart disease, chronic kidney disease, or diabetes, for example, as well as those with disabilities, to register their interest. Although we are moving to Phase 2, please remember that registering your interest does not guarantee you an appointment immediately. When you submit your registration form, you will receive an automated confirmation receipt. When an appointment is available, you will receive an email and text message to confirm your appointment, and some appointments will continue to be made by telephone as well. Priority will still be given to those persons in phase 1A and B, and this includes people who are 80 years old or older, care home residents, healthcare and essential workers, people 65 years chemotherapy, or with severe asthma or COPD. Remember, our appointment system is based on a medical risk assessment that in turn is based on age and clinical vulnerability. I am stressing this because we continue to receive complaints from some younger people getting the vaccine before older people. Please know essential workers are in phase 1, and some of these people are younger than seniors who have no medical conditions. Also, please remember that medical risk assessment is necessary to set appointments. Except in limited circumstances, our medical team cannot look at a person and diagnose their medical conditions, and this is why we do a medical risk assessment. With regard to the number of persons who have registered their interest, to the week ending the 13th of February, 17,605 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 3,715 are black, 8,580 are white, 1,833 are mixed or other, and 3,480 prefer not to say. For those of you who have registered already, again, I say thank you, and please encourage your loved ones who may be in the priority groups to also get registered for that vaccination. We cannot do this alone. If we wish to find out more information about the vaccine and how to support your loved ones, please visit gov.bm/vaccine. It is especially important that we continue to do everything we can to try and reduce the spread of this deadly virus. This includes continuing to wear masks, physically distancing, good hand hygiene, and downloading the We Health Bermuda app, but these measures are not enough by themselves. To repeat, again, getting vaccinated is important as the vaccine will work with your immune system so that you will be ready to fight the disease if you become exposed. If you do get COVID-19, you are likely to experience milder symptoms and become less ill as your body is better equipped to fight off the virus. Those who are not vaccinated are at a higher risk of becoming infected if they are exposed to the virus, and if they become infected, they are more likely to develop serious illness compared with those who have been vaccinated. They also risk further passing this infection on to others, and this includes people within our population who are unable to develop an immune response to fight infectious diseases and are at a high or serious risk that not everyone can get vaccinated. There are people with underlying health conditions such as severe allergy to a vaccine component who may not be able to get vaccinated. And these people can still be protected if they are living amongst us who are those that are vaccinated. When a lot of people in a community are vaccinated, the virus has a hard time circulating because most of the people it encounters are immune. In other words, the virus comes up against a dead end. The more others are immunized, the less likely it is that people who are unable to get vaccinated are put at risk of even being exposed to the virus, and this is herd immunity, and this is, of course, our goal here in Bermuda. I'm also pleased to say that the new COVID-19 vaccination center at the Bermuda College on South Shore and Paget opened yesterday, with the capacity for up to 10 vaccination stations. This vaccination center replaces the vaccination center at the Police Recreation Club. There will now be 2 sites, the Bermuda College campus and the Bermuda Hospitals Board, and these 2 sites will allow the ministry to dramatically increase the number of doses administered to the community when needed. The Bermuda College Vaccination Center will be open Monday to Saturday from 8 a.m. until 8 p.m., and vaccinations will continue to be on an appointment basis only. Please, again, no walk-ins. I would also like to remind all residents who had their first vaccination at the Police Recreation Club that their second vaccination will be at the Bermuda College Vaccination Center. Again, if your second appointment was scheduled for Prospect, you will need to go to the Bermuda College for your second dose, and you will receive an email reminder concerning your appointments. And please do not miss your second dose. It is extremely important to receive both doses, as the two-dose you do get some immunity, approximately 52%, from your first injection. The second dose boosts that immunity to 95% effectiveness. If you do have to change your appointment, we ask that you call the vaccine hotline at 444-2498, selecting option number 2, or email vaccine@gov.bm as soon as you can so that we can reschedule your appointment. Regarding changes to requirements and restrictions once a person has been immunized, as many of you know, ending this pandemic largely rests on the success of vaccines in preventing COVID-19 and limiting its spread. However, vaccines are not a silver bullet that will see an immediate end to the pandemic. While COVID-19 vaccines approved for use are confirmed to be safe and effective, the research about the length of time that provides protection and limits transmission is still ongoing. The reality is that successful attempts to control the virus will require global cooperation and equitable access to tests, treatment, and vaccines. In Bermuda, we estimate that 70% of our population will need to be fully vaccinated for us to achieve herd immunity, and it will take some time to reach that goal. And so a more immediate goal is for us to immunize 90% of persons over the age of 65, and this is, of course, our most vulnerable group. The public health measures will continue, but will be adjusted as follows. Persons who are fully immunized and providing proof of this will no longer be subject to the traveler's first 14-day continuum as it pertains to activities such as dining indoors, attending meetings, and playing close contact sports. However, persons who are fully immunized will continue to be subject to the traveler's testing regime of a pre-arrival test, an arrival test, and a day 4, 8, and 14 tests. These changes will come into effect on the 1st of March, but public health measures such as wearing masks, restrictions on the size of large gatherings, and the number of people seated at tables in restaurants and table service rather than bar service will continue at this time, whether or not you are immunized. Finally, it is important to note that the ministry will continue to be vigilant in monitoring the key performance indicators, which are as follows: the number of confirmed cases, the WHO transmission classification, the vaccine transmissibility data, our reproduction number, and the percent of our population that are immunized. And that is the total of our by priority groups, especially those persons that we spoke about a few moments ago that are our most vulnerable. We are able to make these changes largely because we have seen functioning with controlled border requirements for several months now, and we have been always open to travelers. My closing message to everyone is to continue to follow the public health measures and guidelines put in place for our collective safety. Continue to wear your mask and practice physical distancing and get vaccinated when it is your turn. And as always, stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you, Premier.
Thank you, Minister of Health. And certainly 4 active cases is great news. And I'd like to thank you and your team for the incredible work through all the phases of the pandemic. And I know, certainly looking at you and certainly Dr. Io, I know there's been some very stressful times, but it's certainly due to the dedicated work of you and your team that we are here, and that we are among the world's leading countries in managing the coronavirus, particularly in regards to testing and vaccine doses administered. Including the vaccine doses administered yesterday, Bermuda is now number 7 in the world in the number of vaccine doses administered relative to population size. We are number 5 in the world for testing per capita, and we would certainly be higher than that if we included our Saliva PCR tests in that figure. So through this work, we have managed the spread of the coronavirus, and therefore we can further ease some public health measures for Bermuda. So today, in line with recommendations from the Ministry of Health and with the support of the Cabinet COVID-19 Committee, the Cabinet has agreed that all public health regulations that I'm about to list will remain in place. Indoor funerals will remain where they can hold up to 25% of the maximum capacity in the venues in which they're held, and that's also for indoor religious services. Outdoor funerals will remain at a maximum of 50 persons attending an outdoor funeral. Table sizes in restaurants and nightclubs will remain at 10 persons and no more, and bar service still remains prohibited, table service only. The maximum size for group gatherings in a private or public setting remains at 25 persons. The boat curfew, which is in place, remains at 8 p.m. So all public health measures that were in place for the last 2 weeks will continue. However, the Cabinet has approved changes to the following regulations, and these will be the only 3 changes to the regulations that were in place. The first is that the 12 a.m. to 5 a.m. curfew will come to an end, and the last night of curfew will be Wednesday night. However, all liquor license establishments will now be allowed to remain open until 12 midnight, giving them an additional hour of operations as they've previously been required to close at 11 p.m. The reasoning for this is similar to the rationale that I provided 2 weeks ago for keeping the curfew in place. It is still critical to keep social mixing at a safe level, especially in situations where alcohol is consumed. Businesses will no longer be required to close at 11 p.m. as the curfew has been lifted. And as long as they are not a liquor license establishment, they can remain open. So, if you are used to getting Jamaican Grill at 2 a.m. in the morning, jerk chicken, you may get it again. These changes will come into effect on Thursday, February 18th at 6 a.m. And until these measures are officially changed, please continue to adhere to the curfew as it stands now, as the enforcement of the law will continue tonight, Tuesday night, and tomorrow, Wednesday night. Again, these changes come into effect on Thursday, February 18th at 6 a.m. And as always, all measures will be reviewed by the Cabinet in 2 weeks. The government is pleased to announce the end of the curfew and has no desire to reimpose such measures again. However, it is crucial for everyone to understand that the government will not hesitate to take action and re-implement regulations should this become necessary to keep the people of Bermuda safe. It would be understandable that members of the public will ask, what is the government doing to help to ensure that ending curfew or relaxing restrictions does not lead to a rise in cases later? The Minister of Health stated at our press conference 2 weeks ago that saliva screening has been ongoing since September of last year for Bermuda Hospital Board staff and long-term care staff and residents. We further expanded that to essential hospitality workers at the beginning of the outbreak, where we were able to capture some cases. In order to be proactive and ensure we remain able to detect any latent cases of the virus which may be in the community, we will be beginning enhanced community and occupational saliva screening, which will start this weekend, beginning with local sports teams. The screening program will then expand to include other groups that the Ministry of Health identifies as necessary to screen. The government is keen to get sports to return to play in full, and we appreciate everyone's patience as the country battled the pandemic and got the latest outbreak under control. Contact sports can, however, be a high-risk setting when it comes to COVID transmission. So we have to be cautious in allowing return to play in case there are any latent cases in the community that we have not detected, which could lead to renewed outbreaks. Saliva testing to participate in close contact training will commence this week, starting with the sports with the largest proportion of registrants. On Thursday and Friday, the Ministry of Youth, Culture, and Sports informs me that we'll be testing the football national team's players and domestic clubs next week. Volleyball, which has 100% registration, will test on Saturday and Sunday, and next week further sports will be rolled out. The government encourages all close contact sport athletes age 11 years or older wishing to participate in Stage 3 training to register for Saliva COVID testing as soon as possible so that a testing date can be set up for your sport. While we had initially contemplated commencing Stage 4 of sports this week, due to the slow take-up of registrations and the delay in testing, we will have to wait a little bit longer for Stage 4 contact sports competitive play to recommence. Realistically, it would not be prudent for us to allow contact sports to go to Stage 4 with only a small proportion of athletes testing. So I encourage all contact sports players age 11 and older to register today. Your sporting body has sent the link for your registration, and it is a very quick and easy process. And as I has indicated, it is saliva screening. As I was talking to a footballer last evening who was worried about the nasal pharyngeal swab, and I said, no, this is a saliva screening. Quick, painless, spit in the cup, move on. The government is determined to ensure that we do not hastily remove the legislative mechanisms that have helped us to successfully navigate this pandemic until we are confident that the coronavirus no longer poses a need for a public health emergency here in Bermuda. This Friday, February 19th, the House of Assembly will reconvene and will debate an extension to the public health emergency orders upon the recommendation of the Minister of Health. Also, this Friday, the government will debate the cannabis legislation that was tabled by the Attorney General in December. This legislation is in keeping with the government's election platform pledge to develop a regulated domestic cannabis industry that will create new economic opportunities for Bermudian entrepreneurs while enhancing protections for young persons in our community. I look forward to this debate and encourage all persons to tune into the debate on parliament.bm, 105.1 FM, or on burnews.com. As Bermuda and other countries progress with vaccinations, we must also consider how we will safely increase visitor arrivals to support Bermudians who are in the hospitality business. Supporting tourism is good for our economy. As the Minister of Health announced, the rules for vaccinated travelers will change effective Monday, March 1st. This is an early step that we can take as we look to increase safe tourism to Bermuda. It is the government's hope that our reputation as a COVID-19 safe destination, our reliable testing regime, and our top 10 global rankings in both vaccinations and testing will encourage vaccinated travelers to visit our island in the coming months. As we prepare to welcome vaccinated tourists to our shores, we need to make sure that we are stepping up our tourism marketing as well. The BTA is looking to capture more sports tourism and more wedding business in Bermuda. And to ensure that we can effectively market to this segment, a task force has been set up to streamline the process for large event approvals for both our local entrepreneurs and tourism personnel who may wish to host events in Bermuda. This task force consists of representatives from the Ministry of Health, the Ministry of National Security, the Bermuda Tourism Authority, and the Ministry of Youth, Culture, and Sport. And it is important to note that the protections will be in place. And I'm pleased that we have announced changes to our vaccination strategy as we want to ensure that over the long term, our reopening, or I would say the branding of Bermuda or the welcoming of tourists to Bermuda are making sure that we recognize that we want persons who have been effectively vaccinated from the coronavirus. Restrictions will remain in place for persons who are non-vaccinated, and that is a very important distinction. I will also assure all Bermudians that our focus will not solely be on our borders and tourism. The government continues to work domestically to ensure that our economic recovery plans are executed so that we can improve the everyday lives of Bermudians, and we will continue to execute on our plans to stimulate the domestic economy. I'm pleased to announce that Phase 1 of the Ministry of Public Works Economic Stimulus Program, which the applications closed yesterday, have attracted over 100 applicants. This program offers small and medium-sized contractors the opportunity to participate in infrastructure construction projects. The ministry estimates that these projects will provide work for 243 Bermudians. I am thrilled that so many companies applied to be a part of this program, and I want to commend the Minister of Public Works and the team at the Bermuda Economic Development Corporation for ensuring such wide participation of entrepreneurs. As I begin to wrap up, we do know that many in our community may need extra emotional support. And as always, if you need someone to talk with, call the Emotional Wellbeing Hotline. The phone number is 543-1111, and the line is operated Monday through Saturday from 5 p.m. to 9 p.m. Again, that phone number is 543-1111. What we want to make sure is that you can get accurate, reliable, and timely information from the government of Bermuda, and that is available via our WhatsApp service. Add the phone number 504-6045 to your contacts and send us a simple message saying hi, and you will receive WhatsApp updates from the government of Bermuda. Additionally, you can get government updates by downloading the Tree Frog app. Go to the App Store or Google Play, and in the search bar, type Tree Frog Bermuda and download this free application today. In closing, Bermuda, we are coming closer to a place where we can end this perpetual reality of living under a public health emergency. It is up to all of us as a community to stay committed to actions that will help move us forward. We must continue to wear our masks, maintain physical distance, practice good hand hygiene, download the We Health Bermuda app, and adhere to the public health regulations that remain in place. When it is your turn, please register to get the COVID-19 vaccine. As we stated in the past, our goal is to vaccinate 19,000 people by the 31st of March. The news that we have administered 13,155 doses today is great news, but we certainly have a ways to go. And I know that we will all work together to ensure that our time, energy, and resources can be devoted to rebuilding our island, diversifying our economy, and getting more Bermudians back to work. It is a blessing to be able to speak to you tonight about the future, rather than solely discussing restrictions and regulations. While the pandemic is not over, we have all worked hard to limit its impact on our daily lives here in Bermuda. And we serve as an excellent example to the world. And Bermudians and residents, our sacrifices have not been in vain. Number 7 in vaccinations, number 5 globally in testing. These are all things that must make us proud. And we have done this by working together. I ask that we continue to work together so that we can end this public health emergency and hopefully have a spring and summer that Bermudians and vaccinated tourists can also enjoy. With that, I'm happy to take questions from from members of the media.
Premier, we'll start with the World Gazette.
Good evening.
Good evening, Sarah.
Good evening. You're just saying there's a lot that Bermuda can be proud of in terms of how we've dealt with this pandemic so far. Still, with these Centers for Disease Control still have us listed as level 4, which is very high COVID levels. Do you believe this is reflective of the reality? And if not, is the government working with the CDC to address this?
You want to take it?
I can take it. It certainly doesn't reflect the reality. It's unfortunate that the status hasn't changed, but we have been working through the Office of the CMO to rectify that. We've been in discussions with CDC, proving to them what our current status is, and the status has, as it has been over the last 28 days, which is one of the factors that they look at to monitor it. So we would anticipate receiving some good news very, very soon with respect to a change in our level. Did you want to add anything to that?
Yes, it's just to support what the minister said. Yeah, we have been working with the CDC, and today I actually got in contact with the CDC rep for the Caribbean to basically show him that we have met their criteria to be on level 1. In the last 28 days, we've only had 5 non-imported cases on islands, and that would put us in level 1 for CDC.
Okay. We'd heard there's been some mention of perhaps the order of vaccinations not following the planned route. So far, some cases of people jumping queue, and we had quite a detailed story on that. But could you tell me whether anybody in phase 3 has received the vaccination yet?
Not to my knowledge, no. But when I spoke about this last week, we indicated that the amount of persons that have jumped the queue, so to speak, are very, very minimal. And when you look at the overall factors where we are with respect to vaccinating, administering over 13,000 vaccinations, having a handful of persons jump the queue, I think, is negligible. Though I appreciate it would be frustrating for persons that are waiting to receive information concerning the vaccination. It's a very, very negligible amount compared to the overall amount of vaccinations that we've administered, and as the Premier indicated, being 7th in the world with respect to administration of vaccines. For such a small country as Bermuda, I think that's a mammoth task.
Okay, thank you. We've heard of a 1-week delay with the 3rd batch coming to the island of vaccinations. And it's been said that this is not likely to disrupt the vaccination goals that's been set out by the government. Is that the case? And how, if so, could you explain?
Well, you've heard something that we haven't heard.
Okay, we've been in cabinet all day, so I'm uncertain of any recent news. So,
Yeah.
but
A
the only thing
1-week
that can
delay
be said
in
is
the,
that the
third
1-week
batch.
delay won't stop our progress. We're pressing right on ahead.
Okay.
We have our targets that are set to make. We will be all right.
Okay. This was one from one of our readers on mask wearing for 2-year-olds. What research is this based on? And are there any views to look at that again? I mean, it's quite difficult to keep a mask on a 2-year-old. Mine isn't 2 yet, so I haven't tried it, but she won't keep a hat on, that's for sure. What is it based on? What research is this rule for the 2-year-old to wear a mask based on? And are many other countries have such a low age?
Sorry, could you just repeat the question? I'm not quite clear what you...
Yeah, so this is, we have, so the age in Bermuda for a child to have to wear a mask is 2. Is correct? Anyone over 2?
No,
Sorry, how
I
old?
think it's higher.
I'll look at
but-
the guidance. I'll
Yeah,
try
I'm
and look
looking
up
it
on the
up as
phone.
well because I think it's
How
higher.
old is it that you have to wear a mask? What's the minimum?
We'll look at it. It's not a question we've asked recently, so go ahead and look. I'm sorry. But
We can ask maybe the next question,
Yeah.
and
Yeah.
if you could let us know about that one. We'd also, there is the possibility of employers, was raised in a story in the Royal Gazette, potentially discriminating against people who have not had the vaccine. Is this an issue of concern to the government?
do you want to take that? Do you want to take that?
I believe that the Minister of Labor actually produced a statement a couple days ago to address that particular issue. Clearly, it is a concern to any administration if employers are flouting the law and imposing conditions that, such as vaccination, mandatory vaccination, when the government themselves haven't imposed that as a condition with respect to either working in government or alternatively to members of the public. So it is certainly a concern when employers try to take advantage of their employees. But I do believe that the Minister of Labor would be better seized of that, and I understand that he made a statement a couple days ago addressing that. Something came out of his ministry with respect to that.
So it's something that the government has considered and is prepared to deal with, should that happen?
I would actually invite you to speak to the minister directly concerning that.
Yes, Just on the back on that, regarding the Ministry of Labor, I think that what the Minister of Health has said is correct. I think that they've set out the position. The government is not requiring vaccinations, but I think that there are reasonable boundaries of which can be set. So I'm not saying that that means that employers should mandate vaccinations, but the fact is that if someone has not gotten a vaccination and may be in quarantine and other things, that the employer should probably not be required to provide vacation cover or other things. But I'm sure those are guidance that the Minister of Health, the Minister of Labor, will further clarify as we move through this. But the bottom line is that the government has not required mandatory vaccination. And so in that case and instance, I think that what the Minister of Labor has set out, that would be discrimination unfair.
Do you believe that the Minister of Labour and the government as a whole should supply or offer advice to employers and work with employers with regards to this issue?
It's certainly something that can be suggested. I know certainly that right now it's not at the top of mind for the work of the Ministry of Labor, as I think the Minister laid out very clearly his view and vision for making sure that Bermudians are at the center of the economic recovery and the work which is taking place inside the Ministry of Labor. But I'm welcome to speak to him on those matters, and I know that he might be doing a press conference next week, so those are matters that can certainly be addressed towards him.
Just one question.
Bermuda Broadcasting.
Good evening, Don Burgess, Bermuda Broadcasting. With regard to vaccinations, I know of two people who are in Group 1A that haven't been who registered, who haven't been contacted to get their vaccine yet, and I see people in Group 1B have been vaccinated, and now you've opened it up to 2. Should they contact someone with regard to their vaccination?
I'd like to answer that in 2 ways. One is there were a number of people that were in phase 1 that unfortunately provided incorrect telephone numbers, so it was difficult for them to be contacted. They may have put a hashtag as opposed to a 3. So if you know those individuals, if we can have a chat offline and you give me their contact details, and I'll make sure that they're contacted. It is a 1A and 1B. It also includes essential workers, and not everybody knows who every essential worker is. And B, there's a medical assessment. So unless you're looking at someone who may very well be overweight, you can't necessarily tell whether or not they have any type of chronic condition until a medical assessment has taken place. So because you're sitting there and you haven't been vaccinated and somebody next to you understand has, you don't know what their medical vulnerabilities are. But just let's have a chat afterwards, and you just give me their contact details and I'll make sure they're contacted.
Okay, just to clarify, so somebody who's in 1A and somebody's in 1B, and the person in 1B's got worse physical conditions, the person in 1B will be tested before 1A.
Absolutely. It's a medical assessment. So the reality is you could have somebody that's 45 years old that has severe medical vulnerabilities and a 65-year-old who's doing CrossFit every day with nothing.
Okay, thank you. This question's for the CMO.
Hey.
I thought I'd bring him to the wicket.
Okay. Thank you.
I know I asked this last week about the 70%. When you're talking about 70%, does that include children under 16 years for herd immunity who can't get the vaccine, or is that 70% of the adult population? And what's the total figure for 70%? How many people actually need that in Bermuda to reach herd immunity?
Right. Thank you. So the 70% is for the whole of the population, and that's because the whole of the population is potentially susceptible to this virus. So we're an island of 64,000 people, give or take. So we're looking at just under 45,000 people to be vaccinated for us to get to that sort of level that we desire. As the minister mentioned, will lead to dead-end infections if the virus ever infects people. So that's what we're looking at.
Okay, thank you very much.
Right.
Question 2 or 3 here. It's been over a month since Bermuda's vaccine program began. this is enough time to offer vaccines to frontline and essential workers and the elderly, but there's still a lot of vaccine stock sitting in fridges waiting to get into people's arms. Citizens in their 40s and 30s are the main engines driving Bermuda's economy. Many of them want to feel safe going to work and traveling for business. When is the Ministry of Health going to open up the vaccine program for these essential younger folks?
Well, like I indicated just a few moments ago, we are now opening up the registration for phase 2, which would be 50-year-olds or alternatively persons that have other vulnerabilities, as well as requiring to travel and or it was 2, wasn't 2? Wasn't
50
50? Okay. Yes, exactly. So we're moving quite swiftly. I mean, remember, we started the vaccination program on the 11th of January. So as more supplies come in, then we'll be able to immunize persons in a more rapid basis. But right now, you know that we have, 19,050, the ability to vaccinate 19,500 people. And our objective is by the end of March to have met that goal. And as more supplies come in from the Public Health England, which Sarah told us are delayed by a week, as well as through the COVAX facility, we'll be able to roll out the phase 3, which is everybody. But we're moving very, very swiftly. And like I said, being number 7th in the world, I think is a really, really tall feat for Bermuda.
And what is also important to recognize is that the move to the Bermuda College from the Prospect Vaccination Center will allow the vaccination program to even increase further. As the minister said, they've added the number of stations. They've expanded hours. They're going to be able to, so the more people will be able to get vaccinated. So I expect that the numbers, I think we reported about 3,500 last week. I expect that we'll be reporting a significantly higher number this week as we expand the amount of time, as we continue to scale up this effort. And as the minister has indicated in other times, that once there are other vaccines that are able to come on island, which may be not require this cold chain, then we could see that expansion. But I would tell the most important thing with the coronavirus disease is that the persons who are impacted the most happen to be those that are older and those that have pre-existing conditions. And so that's our focus. And so I hope the 30s and 40s, I understand their angst. I just want them to hold on for now. And then once we get to the place where we have more, we'll certainly be able to roll that out.
Okay, thank you. Talking about the vaccination center, there was a change from 3 vaccination centers to 2. Was the change from 3 vaccination centers to 2 due to the shortage of workers government was already facing at the Police Recreation Club?
Let me own that if I can, because it was all me. I came here and I said we're going to move to 3 vaccination centers. The Ministry of Health did further assessment and said that it made more sense to consolidate the efforts rather than having one at Prospect and one at the Bermuda College in addition to the hospital. That was me. I own it completely. The fact is that now we are able to have singular administration. If we had those multiple sites, there would have been 2 levels of administration, people to check in, all the rest, but a duplication of efforts and resources. Now they went to Bermuda College. They're able to expand the amount of stations, of which I just said, and so we're able to accomplish what would have been accomplished as well. We will have the ability to expand further, and we'll do that. But that was completely 100% me, not with the Ministry of Health, not with the CMO.
Okay, thank you.
No problem.
We always appreciate leaders in our country who can own up to their mistakes rather than some others. With regard to the new vaccination, we moved from 6 from the Police Recreation Club to 10 at the college. We were having problems finding staffing for 6 at the recreation center. How is that being resolved when we move to the 10?
One of the issues concerning staffing is that the same nurses that have been, the community nurses that have been at the forefront of COVID with respect to case management, contact tracing, we might have individuals that purely from exhaustion, having worked at this for such a long time. We now hours. When we were at the police club, there were only certain days that we could have extended hours because obviously Now that we have the facility at the Bermuda College, we've extended our hours, so we are able to then include persons within our community to be able to help us to immunize persons. So we want more personnel to help us with the administration.
Okay, thank you. And my last question. We, Bermuda Broadcasting, heard from a local doctor who's willing to volunteer his time to help give out vaccines, but he was surprised when he was handed a rather lengthy legal document to sign, which apparently would pass on liabilities, including to his medical insurance policy. After reading the Ministry of Health legal document, the doctor then declined to volunteer his time helping at the vaccine center. Why would the Ministry of Health put up bureaucratic hurdles and red tape which caused doctors to decline to volunteer their time in this key effort?
I'll take that if you don't.
Okay.
So it's the Attorney General's office that allows us to be able to protect the ministry, the government, and also the healthcare worker. But the top line, never mind the legalese under it, the top line is that if you're working for the Ministry of Health and we have assessed you as competent to work for us, you are indemnified for all the work you do for the ministry. That's the top line, really. And that's what I would like anybody who's considering volunteering to work for us to remember. There is a lot of legalese, and I agree that we need to go through, but unfortunately this is something that we need to deal with. But the top line, I repeat, is that anybody working for the Ministry of Health is covered, indemnified for the work they do for the Ministry of Health.
Okay, so maybe they didn't understand it
And
correctly.
just as a follow-up to that, I fully support what the CMO has said. The challenge that we have as the government of Bermuda is that if we don't take legal protections, taxpayer money can go out the window sometimes. And we have learned our lesson, and we're not going to cut corners. And so we're going to be very diligent in that. But the CMO has made it clear that any doctor that volunteers their time and services is indemnified, correct? Thank
Okay.
you.
Thank you very much.
Thank you, Tom.
Premier, Media Maya.
Good evening, everyone.
Good evening, Ms.
evening.
Palacio.
My applause here for Media Maya. My first question, because I've been seeing it come up a lot on my Twitter feed right now,
Oh,
there
my.
was an email sent out tonight saying that the bus schedule is supposed to be back into effect or expected to be by 7 p.m. this evening. Do we know if that's still ongoing and correct, and can we expect that buses will be on operation tomorrow as normal?
We can expect the bus will be in operation tomorrow. We certainly can. I know that in cabinet earlier today, the Minister of Transport had indicated that they were looking to get the service back up. So if that 7 p.m. figure was what was given, I'm sure that the minister may be listening and can update me otherwise. And I will ask a member of my staff who's here to send a message off to the minister so I can just get that information and the latest update. What happened today was incredibly unfortunate with the bus service. There was no warning, and it was something that was happened with the Bermuda Public Service Union managers who had a dispute, and they went through the process. It's very unfortunate. All bus drivers showed up for work today, but there was a dispute that existed, and it's unfortunate. It's also a challenge that we weren't able to get out communication in time for travelers. And so the minister, I spoke to the minister, and that is not a situation that we want to repeat. It was unfortunate that the notification came out so late, but typically we have word of industrial action, which may or may not happen. And so it's very unfortunate. I do, without question, unreservedly apologize to persons who rely on public transportation to get to work, rely on public transportation to go about their daily business, and it is not acceptable in any way, shape, or form. So the only thing I can say is offer the apologies, and I know that the Minister of Transport will address this, and there were some discussions to make sure that we have a better way of making sure we notify persons in this case and instance. It was unfortunate, but that's what took place today.
Thank you. And for people to stay updated on what's happening with the buses and the directions of whether or not they're coming or not, there's an app for that, correct, called Leap?
You can go on the government website. It is not, well, there might be a private sector app. I don't know from a government app. From a government perspective, there is a notification if you go on gov.pm Right. Yes, if you go on gov.bm, there is a space where you can sign up with your email address and literally get an email every morning and afternoon on any routes that are canceled. I know it works like clockwork because now they're doing it so it comes at night for the morning run. So whereas before it would come at like 5 a.m., now the email comes at about midnight for the morning run. So went through and it said that I read it every night to see the amount of cancellations that are there. It had said 3 buses to be canceled today, and I had actually shot off a note to the minister, and I said, it's down from last week, good work, and now we're here. So it's certainly a challenge, but I would encourage persons, but we do need to do better on the communications aspect. I'm not going to slice and dice it anyway. It was not good what happened earlier this morning, especially with the delay in notifications from the government on this issue. It's just not okay.
Okay, thank you very much. My next question is about the number of tests that we're starting to get in regularly, like the past week and more, have been like kind of low in the like 200s and 300s of people getting tested. Does that affect anything like with our results? Because before we were being able to test like thousands at a point, like about and around that amount. So does that, like the results coming in, does it differ?
Well, we still are number 5 with respect to having the amount of testing. Over 170,000 tests have been administered. What we want to do is encourage people to get tested. The reality is when we see an outbreak, then everybody is running to try to get tested and they're trying to book appointments. We would like to encourage people to know their status now and to make their appointment to go to Pennell's Wharf or Star of India or Bull's Head to get a test. So you can book right now online, know your status, and if you could assist us, because you obviously have a big following, to encourage people to just go ahead and get tested, get your status known. The more people that we know are impacted, the best way, one of the best ways to be able to address COVID and the spread and the transmission is to identify and then isolate. So if we're able to identify that persons have contracted COVID via testing, then we can immediately move to isolate so that they're not making contact with other persons and then the spread goes on. So if you could assist us, as well as all members of the media, to just remind people testing is free, it's open, it's plentiful, and it's available. And we have been one of the most aggressive countries in the world that have tested, and we want to stay that way. But unfortunately, we do see that we have valleys when we don't have an outbreak. But we're trying to encourage everyone to continue testing. And as the Premier indicated, we're continuing with our community testing with respect to saliva as well. So we've got all these mechanisms at our disposal, and we just want to make sure that members of the public avail themselves to it.
All right, thank you very much.
Thank you.
There's a question I had about, I can't remember if you, Mr. Premier, or Minister Health stated this in your reports tonight, but you mentioned that we are currently at 15% of herd immunity. Does that number account for up to today, or does it account for the up to February 13th numbers that you gave for vaccination?
That is a very good question. We do an Epi Week, and our Epi Week runs from Saturday. It ends on Sundays. So the 13th, 14th, 14th was
14th, sorry.
Our Epi Week would have been up until the 14th. So the epilogical week that we are on now is it's week 6, and it would have been from the 7th until the 14th. So we do our calculations based on an Epi Week that ends on a Sunday. So it would include the Sunday's results. And to date, 15% of the population has been vaccinated with 1 dose, and 4% of the population have been fully immunized, having received 2 doses. So that would have been up to and including the 14th of February.
Awesome. And when could we expect the next shipment of vaccines to arrive on the island?
Ask Sarah.
It was February 25th, but apparently it's a week late. British Airways only flies once a week. No stress, no problem.
Yeah. Like the Premier said, we've been in cabinet all day, and he has a no phone policy, so I would not have necessarily gotten a message from my team saying, or the Premier from Government Health. I didn't get the memo, but I can't look at my phone during cabinet.
We leave cabinet and then we go to polish off our speech and run here. So
Okay.
it's a blur when we leave.
How is the no phone policy going in cabinet?
It works well some days.
I can imagine. My next question is actually about the We Health app on the phone application. Some persons feel like they haven't gotten any alerts, which could just mean that's a good thing, and also that they feel like none of their friends who have it also got any alerts. So I just want to know, is it still like an active thing, and is there any updates on it, and what's the confirmation about the We Health app?
Thank you. I appreciate that. Not having updates is a good thing, and if there were updates of exposure notifications, that would be a very bad thing. but I beg and encourage persons to continue to use it. One of the conversation discussions in which we had at COVID committee yesterday was that issues surrounding We Health and directions will be added to public health guidance, as we want persons when they're in restaurants and bars, especially persons who are working, et cetera. It is important. It is very, very, very important to use it. We have amazing technological tools in Bermuda. The fact that we have so much testing, the fact that we can do this vaccination, the fact that we can do saliva screening, and the fact that we have best in world app to keep us monitored for exposure notifications, I think is a really good thing. And so I'd continue to encourage persons to use it, and we're going to be adding that guidance to the regulations. So in restaurants and bars and places, the reminders will be there, as it is essential in order to make sure that we can remain open. And I think that everyone wants to remain open. I think that people don't want to return back to a place of curfew, but we have to use the tools at our disposal to minimize the possibilities of outbreaks, to make sure that we don't return back to that point. In October, November, when we had this outbreak, we did not have the We Health app. We now have it, and it's essential as a part of making sure we don't go backwards, that people just continue to use it. It is low memory in your phone. It is a lot of battery life. It works with Wi-Fi only. If you only have Wi-Fi, you can go ahead and use that app, and it is certainly helpful.
Can I just add to that? In addition to what the Premier said, the use of technology greatly assists us with respect to having to minimize having so many people with respect to the human resource issue. We can have people that are spending their time vaccinating people, as opposed to having to make calls to contact people if they don't have the We Health app. So we really, really are encouraging people to use it, so that the human element of contact tracing is removed through the use of technology, and we can better deploy those resources of the humans, the nurses, et cetera. Instead of doing contact tracing, they can be immunizing our population.
Okay. Thank you very much. And my last question is about, and I apologize if this was answered last week, but it's about whether those persons who have been vaccinated and if their traveling requirements have changed due to them being vaccinated.
You know how we have the traveler's 14-day continuum that you've asked about with the the colored bracelets?
Yes.
If an individual arrives in Bermuda commencing the 1st of March and they are able to confirm that they are fully immunized, then they will not be required to adhere to the 14-day traveler's continuum. They will, however, be required to continue our testing regime and our protocols, such as pre-test, arrival test day 4, 8, and 14, but they will not have to wait 8 days before they go into a restaurant, et cetera. The traveler's continuum does not apply to persons that have been immunized.
Okay. Thank you very much. That's
You're
my
welcome.
question.
Palacio, just a note to a question in which you had asked regarding the buses. The Minister of Transport was listening, and he advised that as of 6 p.m., the buses were up to 60% capacity, and they are expected to be up full to capacity at 7 p.m. In addition, he is expecting that they will be operating as normal tomorrow morning. So thank you for your questions, and apologies again to members of the public who rely on the public bus service.
Thank you very much.
Premier?
We have an answer
CNN?
for you too on your 2-year-old mask issue. We've looked at the guidance. The guidance does state that 2-year-olds should wear a mask. It doesn't say they should wear them for a long time. It says on public transport, in stores where physical distancing is unable to be maintained, only if they can tolerate
Correct.
it. So that's what the guidance says on the Government Bermuda website. Regarding the follow-up questions that you had, I'm happy to ask the CMO to revert to those with you in writing.
Good evening, Trevor Lindsay,
evening,
CNN
Trevor.
News. I'm good. I don't seem to Maya and Burn News and Don Burgess kind of took
your
most of my
questions.
questions, sir.
It's all right.
Yes.
You let us go early, Trevor.
Yes, indeed. You might get off tonight. Anyway, one
You,
question
Trevor,
I
I
want.
sincerely doubt it.
Yeah, a question I want to ask. There seems to be the Assistant Commissioner Martin Weeks put out a statement yesterday that's caused a lot of anxiety in the community. And I'm going to read from part of this statement was, it should be noted that COVID breaches constitute a criminal offense where appear on records. If it cannot be stressed strongly enough that overseas authorities may take note of these offenses should you be convicted in court. Any questions, travelers, or their reasons for having committed offenses against the COVID regulations when seeking entry into their country? That's caused some.
Happy to respond, Trevor.
Thank you.
It
The rest of my statement. Premier, such a damning statement. Your Your comment on this,
It was a
Premier.
conversation, discussion in the meeting that I'm not allowed to talk about, which happened
Okay.
earlier today. However, it is unfortunate that the Assistant Commissioner made that statement. But as you will remember and recall, the government of Bermuda does not control the Bermuda Police Service. We
Yes,
only
sir.
fund the Bermuda Police Service. We do not like the imposition of the stop list, but what he is saying is actually factually correct. And it is factually correct that a violation of public health emergency orders is a criminal offense, and criminal convictions, if found convicted, could lead to impositions from other jurisdictions. One of the things that we are doing, however, is that the minister will shortly bring in a paper to amend the Public Health Emergency Act and the Quarantine Act to put in place fixed penalties, which I think will remove it. The minister would know better than me, will remove it from being a criminal offense to a fixed penalty offense. Money. Versus, going to the trial and judge and actually record. So what he does say is factually correct. We are changing that, so it's not the place. But the one thing that I just want to encourage persons is please obey the rules and please don't try to break them. It'll be a little bit easier come Thursday at 6
Yes, sir.
a.m. But please, they are there for a reason. And the reason why we're able to relax the curfew is because people obeyed it.
Yes, worked well for me. I've been getting my rest quite early. Minister of Health, we have many seniors residents, meaning, i.e., Elizabeth Hills, Hayden Trust properties where seniors live, and I'm not sure if you got numbers on, or do you have community nurses that are attending these facilities to check and nervous of this COVID, the whole scenario. Are you monitoring? How are they being monitored? Reference to getting vaccine, or is there any thought of even a mobile vaccination center for those facilities?
That point with respect to the mobile vaccination has not been lost on the Ministry of Health and the government. It is certainly something that warrants exploration. The challenge that we have right now is that the Pfizer vaccine has specific cold chain requirements, and therefore, if it is not kept at the requisite temperature, we could spoil it. And we certainly, with only 19,500 doses, don't want to take the risk of having any wastage. When we are able to secure other types of vaccines that do not require that particularly strict adherence to the cold chain, then we will be able to look into mobile vaccinations, having doctor's offices, just like you can go and get a flu shot at the doctor's office, having the doctor's surgery also help with the administration. But that will be when we are able to obtain a different type of vaccine that doesn't have the requisite cold chain requirements.
Thank you, Premier. I asked you last week, so I'm going to ask you again this week, and this was off record. In reference to the economy and this upcoming tourism season, do you expect the economy to get worse before it gets better? What does our forecast look like?
I think it'll be very hard to be worse than the second quarter of last year, where there were no airplanes and we were in a state of forced lockdown and shelter in place as we were mopping up coronavirus cases around the country and making sure that we avoided an outbreak. So I do not believe that we'll be able to go back to that place. And if we do, I'm sure I won't be sitting here. And I just say that to state the facts. On the issue of and I'll say on the issue of the economy getting better, I believe so. Whether it's the stimulus measures that we're going to put in place, whether it is the hope for a better and brighter tourism season, whether it's the opening of a new hotel and casino later this year, whether it's work that's going to continue, whether it is the increasing work which is happening in the international business space, more insurance companies going to Bermuda, more fintech companies coming to Bermuda, and the work of which we're going to continue to do. I think that that's critically important. And so from that case, I think that we will get better, and the future will certainly be a better one. But it's not going to be easy, and it's going to be a lot of hard work. I know that there's a significant amount of persons in this country that are struggling, and so the conversations that we have around the cabinet table, the conversation we have in our caucus, is about how do we make sure that we're doing everything we can to make conditions better for Bermudians who are struggling and challenged. The removal of the restrictions will go away, certainly, and we will just continue to keep a very tight leash. But the one thing I can say is that we will not hesitate to reimpose restrictions if we have a hint of an outbreak in the country. We learned our lesson in that in November, and that will not happen again. And so it's important for all of us, if we want to make sure that we continue on this path, to do all the steps of which we've always laid out. Follow the regulations, use the We Health app, and get vaccinated when the opportunity presents itself.
And the supplementary is the tourism season. What does the cruise ship season look like? Any discussion? And I know you said late last year that there were no discussion until April.
There were. That discussion continues. As I had indicated last week, we did have a meeting with the Ministry of Health, BTA, and the Ministry of Transport on these matters. The Minister of the Minister of Transport might have something to report in the near future, but we continue to work with cruise ships to identify what we can do going forward. But the one thing that is clear is that we have a policy of that Bermuda will only be safe if we have vaccinated travelers, and it will be very difficult for us to do things outside of that. So we continue to work with our cruise partners regarding that. We do not need to take risks with our local economy, because I think it's important that we can support those persons that are working here, and an unnecessary risk would be, boatloads of people, literally and figuratively, who are unvaccinated.
A question on immunization. How does Bermudians prove they have been immunized? Is the paperwork for that?
You get a card that that confirms the date of your immunization.
On both?
First dose, second dose, and the dose is signed by the doctor or the nurse that administered it.
And what we will say is that I know that today they're running a test on a vaccine passport. So I know the FinTech team had advised me that they're working through those things. And so we are going to, that's the reason why we're putting this in place March 1st, to make sure that we have a foolproof method, but we will have a more high-tech method than just a card that you carry around. But that's what we have right now. But there is an entire electronic immunization record system. Everyone who gets vaccinated in Bermuda is entered into that system, and that will enable us to quickly stand up and vaccine passports and vaccine confirmation inside of mobile applications.
My last question, sir. An update on the ankle braces situation. Did you get any word on that?
Typically, my team gives me questions that are outstanding, and I don't have that today. The thing was late. That is my apology. At Aranca, can we make sure that we get a response to Mr. Lindsay tonight, if not tomorrow, because I know it is late, and I want to observe good working conditions here, the government, as you all are past hour 5. Trevor, my sincere apologies on that one. Cheers. But we'll get that response to him tomorrow.
Yes, Premier.
Thank you very much.
There are no further questions.
Thank you. Members of the media, it's an absolute pleasure for you today. I hope members of the public watched and have been informed. Thank you for your continued questions. Please make sure to remain vigilant. We are at a good place, whereas a lot of other countries are not at that place, but we have to continue to keep up the work. Please continue to adhere to restrictions. Don't tear it, and let's make sure that we can have a good future as we move forward. So with that, thank you, Bermuda, and good night.